Hi Denise, so I saw that you checked off on your medical history forms that you do smoke cigarettes daily. I would just like to take the time to talk to you a bit about this and just go over some risks and benefits of it, and then talk to you about some counseling resources. Do I have your consent to proceed with this?
Yeah, that's okay.
Awesome. So to start off, can you tell me how many cigarettes you smoke a day and for how long you've been smoking?
I smoke about half a pack a day, so whatever that is. I actually did quit a while ago for like 6 months, but things got busy and I was stressed, and it got to the point where I just needed to have smoke breaks to calm myself down. My stress went away, so I've been smoking regularly again for about a year.
Wow, well, that is a very big accomplishment, and it sounds like smoking is a bit of a stress reliever for you. I do want to let you know that relapse is very common, and it does usually take a few tries before quitting for good. Can I ask what method you used to quit for the 6 months?
I just went cold turkey. I thought it was the easiest way to do it, but I think it just made my stress worse.
That makes a lot of sense. Quitting on the spot without any help can be very difficult, especially where those withdrawal symptoms are probably adding to the stress on your body. However, it is important to highlight that you were able to quit for those 6 months, so it does mean you can do it again. Can I ask why you quit?
Well, I know it's not great for me, and my husband was finding it annoying that I kept leaving and going outside for a smoke because he doesn't. So I figured I'd stop, but it clearly didn't work out.
Okay, so it sounds like you have a few reasons that motivated you to quit. And you noticed that there were some negative side effects as well as it was impeding on your time with your husband. However, it was a bit harder than you expected. So as a dental hygiene student, I do recommend that the best thing you can do to protect the health of your teeth and your gums is to quit smoking. So what do you know about the connections between periodontal or gum disease and smoking?
I don't really know much other than that it's not good for me.
So you are completely right in saying that. Smoking actually does increase your risk of getting gum disease, which can either be reversible or irreversible depending on the stage you're in. However, once you do have it, smoking does cause a delayed healing response, so it's harder to get rid of it if it is reversible. It can also lead to tooth loss because it can affect your bone in your jaw, and as well as increase your risk of oral cancer. And then additionally, it can cause some tooth staining and some bad breath, which I know you did mention was bothering you before. So here is a mirror. I just wanted to show you a few things. So in your mouth, if you stick out your tongue, you can see that thin white coat that's covering it. That's caused by the smoking, and that's what's causing the bad breath. As well as along the gum line, you can see some redness starting, and it's a bit puffy and inflamed. That's the start of your gum disease. Right now it is reversible if the proper measures are taken. However, it can progress and get worse. And beyond just the mouth, there are other harmful effects that smoking can have on your body, like increasing your risk of heart disease, lung disease, having a stroke. And I know that you're still young right now, but if you do plan on having kids, it can affect your fetus during pregnancy. If you decide to smoke during then, it can cause birth defects as well as sudden infant syndrome death. So that is definitely something to be cautious of. So can you tell me what you think about all this?
Wow, I knew smoking was bad, but I didn't realize it did that much to my mouth.
Yeah, many people don't usually make that connection, but it is important to realize what you're putting yourself at risk for. So I did want to ask you now how you felt about quitting. Are you ready?
Well, now that you bring it up, I think I do want to try it again.
Okay, that's great. And I just wanted to assess your readiness on a scale of 1 to 10, 1 being not at all, and 10 being completely ready to quit. How do you feel about quitting, let's say, next week?
I think like a 7.
Wow, so that's a really high number. Why a 7 and not something lower?
I actually did feel healthier when I quit last, and it saved me some money, which is nice, and I think my husband appreciated it too. I'm just not good at handling stress, so I'm interested in getting help for that, and I do plan on having children, so I would like to be smoke-free before then.
Awesome. So it sounds like you have gotten the benefits from smoking, or from quitting smoking. What helped you not relapse for 6 months?
I chewed a lot of gum.
Wow, that sounds like a very helpful strategy. A lot of people do recommend that. Is there any other triggers that you have besides just stress though?
It's mostly stress, but sometimes when I'm hanging out with friends and they go out for a smoke, I go with them.
Yeah, those are definitely both very common triggers. Some strategies that might help with this is maybe going for a walk to distract yourself, as well as continuing to chew the gum, like you said. I do recommend that you do chew on sugar-free gum, specifically sugar-free gum that contains an ingredient called xylitol. And this this just adds a cavity preventing aspect to it. So it's kind of like killing two birds with one stone. You're getting two benefits out of it. And then I also encourage you to tell your friends that you are quitting, because they can act as a support system and help you refrain from trying to smoke again. I do know that your friends do smoke, like you had mentioned, and maybe taking it out of your environment for the first few weeks when those withdrawal symptoms are very heightened might be beneficial, and so you feel like you're more controlled over yourself. So do you think any of these strategies would work for you?
The gum definitely will, and I'll explain to my friends. They're pretty understanding about that type of stuff anyways.
Awesome. So these are great first steps. Now I did want to ask, when you think about quitting again, what approach do you think would work for you? Going cold turkey again, maybe reducing your nicotine gradually, or switching brands of nicotine?
I think this time I'll take it slower and gradually reduce it. I don't think I can just cut it off again like last time.
That sounds like a really great plan, especially how you mentioned the going cold turkey didn't work out for you. I would like to go over some options with you that can help with that gradual reduction and see what ones might stand out to you or you think you would use. Is that okay to you?
Sure. I don't really know much about that sort of stuff.
Awesome. So there are many nicotine replacement therapies, and what these do is give you the same effects that nicotine does from smoking, but it eliminates the actual act of smoking. So there's things like nicotine patches, which you just stick on your arm or anywhere else in your body. There's also nicotine lozenges, which you just place in your gums, and then there's nicotine gum and oral inhalers and sprays. So all of these will help you gradually reduce your nicotine use, and many people have found these very helpful for them. However, I did want to let you know that there are some side effects with these, and you should definitely consult with your doctor before using them. Specifically with the oral inhalers and sprays, it can cause some irritation to your mouth or your throat. And then the gum, in severe cases, can dislodge any fillings that you might have. But again, it's always important to weigh out the risks and benefits with these. And then if you are finding those withdrawal symptoms very intense and hard for you, there are prescription medications that you can also discuss with your physician that can help with those symptoms. So after learning about a bit of these options, what do you think would work best for you?
I think I'd be comfortable with something more simple like nicotine gum or patches. I don't think I'm ready for prescription medications.
Yeah, that's completely understandable, and many people do use nicotine replacement therapies and find them very helpful, and they do help with those cravings during the quitting process. I also have some resources here that I'd like to give to you. This one specifically just goes over some coping strategies and skills that you can use and implement in your routine when you are quitting that can help you get over those intense cravings. And then this one just goes over some of the negative effects that can be a bit of an encouragement for you when you think that you might relapse again. And if you forget anything that we've talked about or everything that we've talked about today, it's another great reminder. I've also included in those packages a phone number called the Smokers Helpline, and it's a great tool and resource that you can call at any moment, and they can offer you some distraction or more strategies as well. And then I do encourage you to go on the internet. There's so many online resources for you. And I did want to let you know that with some of the nicotine replacement therapies, they are a bit on the expensive side, but there is a website which I've also included that's called Stop on the Net, and it offers those nicotine replacement therapies for free, and they mail it right to you. So I definitely recommend taking a look at that and taking advantage of that for sure, because there's so many programs out there. But with everything that we've discussed today, if you feel ready, the next step is to set a quit date. So usually people find it helpful to pick a date that's meaningful to them or within the next week, so they're more likely to do it. So what day do you think might work for you?
Well, since it's the first of the month next week, I'll choose that day. That makes it pretty easy to remember.
Yeah, that sounds like a really good plan. And that gives you a great first start, and then we can arrange a phone call next week where we can just check in, see if there's anything that you are struggling with or finding challenging, and just go from there. So how does that sound to you?
A phone call would work better for me.
Awesome, that's great. So just to recap, we did talk about the effects of smoking to your oral health and overall health, as well as talking to you about your triggers and some strategies that might help with those. And then I have given you some resources to take home as well. And I I did want to let you know that you do always have support available to you.
Thank you. I actually appreciate you taking the time to plan this out with me. My husband doesn't really get it because he's never smoked before, but it's nice to be motivated again.
Awesome. I'm really glad to hear that, and I will speak again with you next week on the phone.